Welcome, and thank you for taking the time to watch this demonstration on meaningful use, how to achieve the core and menu measures. This video demonstration is on core measure number 5, maintaining an active medication list. Let's get started. First, let's open up the PDF from the MTBC website describing in detail the active medication list core requirement. This is the eligible professional meaningful use measure number 5 out of 15, maintain an active medication list. And the measure here is for more than 80% of all unique patients seen by the eligible provider have at least one entry recorded as structured data. Now, you can either have one entry of a medication for a patient or an indication that the patient is not currently prescribed any medication. And there are no exclusions, which means all providers are subject to this meaningful use measure. Now, active medication list is all of the medications that a patient is currently taking. And as we've described earlier, a unique patient is the patient who is seen multiple times during the 90-day reporting period, will only be counted once for that entire reporting period. Now, the attestation requirements for this measure are similar to ones that we've seen in the past in regards to numerator and denominators, except there are no exclusions for this measure. All providers are subject to this requirement. The denominator will be the total number of unique patients seen during your 90-day reporting period, and the numerator will be the number of patients among that denominator or in that denominator who have a medication recorded as structured data or an indication that the patient is not currently prescribed any medication. And here again the requirement is 80% need to have a documentation of a medication or a documentation that no medication is currently prescribed for this patient. So let's go ahead and see how this is met through the EMR. To open up a patient's record in the EMR, use the patient search to find the patient you're currently looking for. Double-click on that patient's name to open up that patient's account, and click into the chart section to go to the clinical documentation portion of the EMR. Once we click into the charts, we'll open up the current chart for this patient, and we'll go directly to the plan of care. On the plan of care for any patient, you'll see the current and active medications for that given patient. Here we can see that this patient is on 3 medications. This patient has already met the meaningful use requirement of documenting a current medication on the patient's record. To add a new medication onto this patient's record, we would simply click into the New Medicine box, review the pharmacy benefit plan information, and enter a new medication. If we have a patient that is not currently on any medications, we will simply select No Medicine from the Plan of Care Medication section. Let's go ahead and see how that's done. Let's select this patient, John Smith, and go to this patient's chart. We'll go to the Plan of Care, and here we will see that the option for No Medicine is currently selected. That is the default selection for any patient that does not have a current medication documented. This option of selecting No Medicine is the method by which you will document that there are no current medications for this patient. This meaningful use core measure requires that you document one medication for 80% of your patients, or document that there is no current active medication for those patients.